Hello everyone and welcome to Edusurg Clinics. I am Dr. Gunjan Desai and today we are going to discuss a very important topic that is medical ethics in clinical practice. So ethics and clinical practice are two parts that we are going to discuss, and then we are going to see some actual scenarios where ethical decision making plays a role. How you can manage patients when these scenarios come into play. We will discuss the legality of it as well as ethical and moral responsibilities that is a part of our field as a doctor. So, when you are asked what is ethics, it's a very difficult question sometimes. I can make out of all the literature is that ethics is the why, or basically the fundamental moral principles that provide a direction to action. So basically, why an action needs to be performed, that is ethics. On the other hand, when it comes to clinical practice, it is the how or how to apply ethics in practice. So that is clinical practice and something that has come up recently. And if you see the American Medical Association, there is a big chapter on code of professional conduct. And this is very important point in applying ethics into practice. For most of the problems that you face in clinics, you have to provide understanding to the patient and the options to the patients in a way that they can also be a part of decision making. So that is a collaborative decision making by the doctor as well as the patient. So the how or applying ethics in practice is clinical practice part, which we will see in the next part of this video. And the why is basically the fundamental moral principles that provide direction to action. So before we begin, I would suggest everyone to read this novel. It's My Sister's Keeper, or if you want to see the movie, there is a movie by the same name. In the novel, there is actually, it's a true story. Molly and Adam. Molly was someone who was diagnosed with Fanconi's anemia at the age of 1. And what this means is that she's going to need a lot of treatment with a high chance for leukemia, and the only long-term cure is bone marrow transplant from an HLA match relative. Now, as the story goes, I'll keep it very brief. The parents were not an HLA match, and then they started creating embryos actually to aid in genetic selection as an HLA match. And that is how Adam was created, to be Fanconi anemia free and HLA match. So a lot of embryos that were not meeting these criteria were discarded. And Adam provided treatment for nearly 10 to 11 years to Molly and actually did the bone marrow transplant with no harm to Adam but major benefit to Molly. However, at the age of 11, Adam then files a case for emancipation. What that means is that Adam then tries to separate the decision making from his parents because he feels that he is being used only to treat Molly. Okay, so this is how this story goes. Now we will discuss this story and why I am discussing this story here, because there were a lot of ethical issues as well as legal issues in this book, and we will discuss this in the third part of this series. Okay. So medical ethics, ethics is coming from a Greek word ethos, which means character. They are basically the fundamental moral principles that guide healthcare professionals. These are the values, principles, and beliefs that guide our behavior with a patient as well as in the society. The key point is to keep patient's interest above personal interest. This looks like a very simple line, but it's a very important line in practice. Keep patient's interest above personal interest. And a very important point that's also mentioned in the Hippocratic Oath is primum non nocere, or first do no harm. Okay, so basically, medical ethics is do not harm the patient, keep patient's interest above personal interest. The key four pillars, and we will see them in a lot of detail, are autonomy, beneficence, non-maleficence, and justice. What does that mean? Autonomy is basically respecting a patient's right to make their own informed decision. The informed word is very important about their health and treatment. Unless you inform the patient properly, autonomy cannot be respected. Beneficence is, like I said, keep the patient's best interest in your mind and promote their well-being. So that is beneficence. Non-maleficence is basically do no harm. So that is non-maleficence. Maleficence is harm. Non-maleficence is do not harm. Justice is the only pillar of ethics that deals more with an equitable distribution of healthcare, and we will see a scenario where justice comes into play. But basically, it's a doctor's responsibility of ensuring that healthcare resources are distributed fairly and equitably among all patients. So these are the four pillars of ethics, basically represent your best understanding of moral responsibility as a doctor. And as we grow in practice, as we grow in experience, a reasoned reflection will evolve your thinking of what is ethics and how to apply it in practice. So seeing these parameters in detail, autonomy is basically like this bird allow the patient a choice, but the important word here is informed. So unless you inform the patient of what the various options are and give them a proper understanding, it is very difficult to respect patients' autonomy. Right to make informed decisions requires informed consent. It also requires that you discuss the patient's cultural history, the patient's social history, financial history, disease related history. All these points you need to discuss without bias so that the patient can make proper decisions. Remember that the patient has a right to refuse or withdraw treatment even if it leads to harm or death. That is the patient's right. But it is important to assess whether the patient is stable mentally when the patient makes this decision, because the autonomy clause is limited when the patient lacks capacity. Physicians should provide information in a clear, unbiased way without coercion. Respecting autonomy builds trust in the doctor-patient relationship. Now coming to beneficence, like I said, it's our duty to promote well-being and act for the patient's benefit, prevent and remove harm, and balance discomfort with long-term benefits. It involves empathy, compassion, and reassurance. And like I said, you have to consider the patient's values, culture, and personal goals when you are making these decisions. So this is something known as cultural competence. And again, the societies outside India put a lot of effort on developing cultural competence as a quality to enhance collaborative decision making. Now, coming to non-maleficence, like I said, it is the core principle, primum non nocere from Hippocratic oath also, first do no harm, should not cause unnecessary injury, suffering, or risk to the patient. Now, remember that harm can be physical, okay, psychological, social, or financial. That's some harm can be acceptable, like a surgery is going to give discomfort to the patient for a short-term period, but with long-term benefits. Remember that non-maleficence deals with various NABH norms also, like patient safety, medical errors, and harm reduction. Out of these points, beneficence is something that may overlap sometimes with autonomy or conflict with autonomy. And at that point, there are different legal aspects in deciding whether autonomy is going to take over or beneficence is something that is important. And we will see this in our part on ethical decision making. Now, coming to justice, that is fairness and equitable distribution of healthcare resources. Like I said, this is an area which focuses on a doctor's role in society. So, equal treatment of patients regardless of gender, caste, class, religion, or economic status, that is justice. Address issues of access to care like urban versus rural or rich versus poor. Justice in clinical research basically means a blinded selection and a fair selection of participants without exploitation, and involves ethical rationing when resources are limited. Something like organ transplants, or say you have to shift a patient to ICU, something like that. Basically, justice needs that you are fair, okay, and you provide resources to each and everyone who is in need. So you have to balance individual needs versus society's needs, like triage during an calamity or a disaster response, like vaccination programs, right? So that is what is justice. So these four and the details that we discuss are basically the why of actions that we take in society as well as with a patient. Okay, so ethics basically answers the why and provides direction to action. In the next part of this series, and we have three videos in this series, like I said, in the next part, we will discuss the actual performance of these principles, including a detailed discussion on informed consent, code of professional conduct, and we will continue our discussions on how to do collaborative decision making. Thank you.